Pins and needles, or paresthesia as they are otherwise known, are uncomfortable burning or prickling sensations caused by pressure on or damage to nerves, usually in the hands and extremities. It can refer to prickling, burning, tingling, numbness, itching, or even skin crawling feelings, which may be of physical or psychological cause. As with many other conditions explained on this channel, it's usually harmless and painless, though may be a sign of a more serious medical issue. Paresthesia may be transient and acute or chronic, and most commonly presents as pins and needles after pressure on a limb causes it to fall asleep. Before trying to understand how nerve suppression causes these feelings, it is helpful to have a better understanding of how the nervous system they belong to is organized. The entirety of the nervous system consists of two components: the central nervous system, which refers to the brain and spinal cord, and the peripheral nervous system, which is all of the nerves outside of the central nervous system. The nerves belonging to the peripheral nervous system are further classified in two ways, based on their connection and direction. Nerves which are from or end at the brain are called cranial nerves, and those which are from or stop at the spinal cord are referred to as spinal nerves. In terms of the direction of these nerves, there are both sensory and motor neurons. Sensory or afferent neurons transmit impulses from sensory organs to the CNS along the dorsal route. These are responsible for senses in the skin as well as other special senses like vision, hearing, taste, smell, and balance. They also communicate information such as fullness in the stomach and regulatory information such as blood pressure and pH. Motor or efferent neurons transmit impulses from the CNS to effectors, which are either muscles or glands, along the ventral route. Motor neurons are further classified by whether they are somatic, meaning they communicate voluntary actions such as contraction of skeletal muscles, or autonomic, referring to organs, glands, and involuntary tissues, for example, cardiac or smooth muscle. Within the autonomic nervous system, there are both the sympathetic and parasympathetic nervous systems. The sympathetic nervous system prepares the body for action, for example by increasing heart rate, concentration of sugar in the blood, releasing hormones, or other fight or flight responses. The parasympathetic nervous system, on the other hand, is responsible for tranquil actions, such as releasing saliva or digestive enzymes, among other things. These two systems usually work antagonistically. For example, the sympathetic nerves dilate pupils, while parasympathetic nerves constrict pupils. The causes of paresthesia can be grouped depending on whether they are transient or chronic. Temporary paresthesia is caused by a process called obdormition, which is numbness caused by nerve pressure or lack of movement. The electric shock kind of paresthesia is caused by tweaking any nerve in the body, most commonly the ulnar nerve in the elbow, due to it being the largest nerve that is unprotected by bone. When there is sustained pressure on a nerve, for example, when putting weight on a limb or sitting in an awkward position, nerve impulses to that area are restricted, resulting in pins and needles. Some studies suggest that they may also have viral causes, from pathogens such as the herpes simplex virus or varicella zoster or shingles virus, which usually cause tingling sensations along the distribution path of the nerves they affect. Moreover, stinging pain and numbness can occur if an extremity undergoes a rapid temperature change, as the nerves are overly sensitive to the massive heat transfer that takes place. Chronic paresthesia is slightly more complicated, though we generally have a good idea about what may cause it. A disease affecting the neurons is one of two leading causes. A prolonged immune response may initiate paresthesia, and irritation to the nerves as a result of inflammation may be indicative of rheumatoid arthritis or carpal tunnel syndrome. In carpal tunnel syndrome, the median nerve, which is the main nerve in the arm, becomes compressed in the carpal tunnel, the passageway on the inside of the wrist connecting the hand to the forearm, causing paresthesia. It is likely caused by obesity, injury, or genetic predisposition, and simple procedures like carpal tunnel release, which may be done endoscopically, can alleviate the causes and symptoms. Apart from carpal tunnel, pins and needles can also be a result of chronic neck and spine problems putting pressure on the surrounding nerves. Along with this indirect damage, the chronic neuronal causes may also be in the form of direct damage or neuropathy, arising from an injury like frostbite, infections such as Lyme disease, medications like chemotherapeutic drugs or benzodiazepine withdrawal, or more severe conditions like multiple sclerosis, stroke, or traumatic brain injury. Poor circulation is also a cause of paresthesia, albeit less frequent. This more commonly affects the elderly and is mainly caused by atherosclerosis, which is the buildup of fatty deposits known as atheromas in the artery walls, which may rupture and cause blockages downstream or promote blood clotting, which can further inhibit flow. These blockages mean that neurons lack the capability to sufficiently send signals to the brain. The lack of necessary blood and nutrients may also be caused by malnutrition or vitamin deficiency, as well as metabolic disorders like diabetes. There are also other, more unique types of paresthesia. Limiti sign is a sensation where an uncomfortable electrical impulse runs through the back and limbs caused by a compression of the upper spinal cord and is a useful indicator of some severe neurological or bone conditions. This shouldn't be confused with another type of paresthesia, psychogenic chills, which are the almost cold feeling shivers we get down our spine as a result of emotion. While shivering is usually a way to generate heat in response to cold temperatures and is regulated by the hypothalamus, it can also occasionally be formed by mere cognition or stress in a process similar to goosebump formation. The treatment for acute paresthesia is relatively simple, though more severe chronic cases are more problematic. Acute paresthesia from nerve compression usually resolves on its own a few seconds after pressure is removed, and long-lasting pins and needles, if caused by certain medications or a poor diet, will typically go away once the balance is restored. Generic drugs that have been proven effective include the immunosuppressant prednisone, commonly used to treat rheumatologic conditions. Other treatments include intravenous gamma-globulin antibodies, as well as anticonvulsants and antivirals. However, these all depend on the primary cause. Carpal tunnel syndrome can be treated with both surgical or non-surgical methods, such as wrist splinting or anti-inflammatory medications. If the chronic paresthesia is caused by nerve damage, this can be managed through targeting the source of the issue, and in the case of peripheral neuropathy, using a cream made from capsaicin, the spicy component of chilies. However, more severe and even fatal neurological conditions causing these symptoms are challenging to treat, which is why much research is being devoted to finding cures and improved treatments for autoimmune diseases such as multiple sclerosis. In these cases, palliative care may include topical therapies such as the anesthetics lidocaine and prilocaine. Paresthesia from stroke may benefit from high doses of the drug baclofen, used to treat muscle spasticity in patients with MS or Parkinson's disease, which is believed to work by inhibiting neurotransmission. The best way to treat paresthesia and its causes is through avoidance, though once again, if ever concerned that it is becoming a common occurrence, there is plenty of guidance online. If you are suffering from a chronic condition that may include tingling as a side effect, then your GP will have likely informed you already, and luckily, it is only in very few instances that the irritating feeling leads to a more harmful condition.